Hi everyone, my name is Nicole Grimmel and today I'm going to be presenting my Disease of the Cell project on cystic fibrosis. Cystic fibrosis is a genetic disease that affects multiple organ systems, and I'll just be covering the cellular basis of the disease, its impacts on the body, current treatments that are there for CF, and emerging research that is aimed at improving patient outcomes. Here is my paper just stating my name and the date, August 19th, 2025. Okay, so what is cystic fibrosis? Cystic fibrosis, or CF, is a genetic disorder caused by mutations in the CFTR gene, which stands for cystic fibrosis transmembrane conductance regulator. The CFTR protein functions as a chloride ion channel in epithelial cells which line organs such as the lungs and pancreas. When the protein is defective, chloride ions transport is impaired, leading to thick, sticky mucus buildup. This mucus causes complications in multiple organs and severely affects patients' health. In the image, you can see an example of that thick buildup in the airways. So, the cellular basis of CF. At the cellular level, CFTR mutations disrupt ion transport, particularly chloride and sodium ions, which are essential for maintaining fluid balance. This disruption causes thick mucus that impairs mucociliary clearance in the lungs, reducing the ability of cells to remove debris and pathogens. Additionally, airway epithelial cells produce heightened inflammatory responses even in the absence of infection, which contributes to tissue damage over time. And in the images, you can see airways that are impacted by cystic fibrosis. The CTFR is not allowing the transport of those materials. Okay, so what are the affected organ systems and organs by cystic fibrosis? Cystic fibrosis affects multiple organ systems. In the lungs, mucus buildup leads to chronic infections, bronchitis, and eventually respiratory failure. The pancreas experiences blocked enzyme secretion, which causes malabsorption of nutrients and poor digestion. The liver may be affected due to blocked bile ducts, potentially leading to liver disease. And finally, the reproductive system is impacted, particularly in males, who often lack a vas difference, resulting in infertility of males. And the picture just highlights those organs that are mainly affected. So how is cellular function affected by CF? The cellular functions impacted by CF include disrupted ion homeostasis, which leads to dehydrated mucus, impaired mucociliary clearance, and altered cell signaling. The heightened inflammatory state in airway epithelial cells contributes to further tissue damage and disease progression. These cellular level dysfunctions directly lead to the clinical symptoms we see in patients, such as chronic respiratory infections and digestive issues. So the image here just kind of shows the progression from the cellular level to the organ level of the effects of CF. So, genetic basis of CF. So, cystic fibrosis is caused by mutations in the CFTR gene located on chromosome 7q312. It follows an autosomal recessive inheritance pattern, meaning that a person must inherit two defective copies of the gene, one from each parent, to develop the disease. Over 2,000 CFTR variants have been identified, with the most common being an F58DEL, which results in misfolded CFTR proteins that are degraded before reaching the cell membrane. Genetic testing is recommended for individuals with symptoms, siblings of affected individuals, and prospective parents considering carrier screening. The image here just shows on chromosome 7 where the CFTR gene is located. So what causes CF? Unlike cancer or other proliferative disorders, CF is not caused by failures in the cell cycle checkpoints. Instead, it results from mutations that lead to abnormal folding and trafficking of the CFTR protein. Epigenetic or lifestyle factors do not cause CF. Environmental factors such as air quality, nutrition, and treatment adherence can influence disease severity and quality of life. In the image here, I apologize that it's a little blurry, but in A, it is showing what a normal CFTR gene looks like when it is folded, and in B, it is showing the mutation of the fold. So it can be seen in the first purple line, it is misfolded there. So how do you diagnose and screen for CF? CF is often diagnosed through newborn screening, which measures immunoreactive trypsinogen levels in the blood. If abnormal, a confirmatory sweat chloride test is performed, which remains the gold standard of testing. Genetic testing for CFTR mutations is also used, particularly in atypical cases or when there is a family history. These tests allow for early identification and intervention, which is crucial for managing symptoms and improving outcomes. In the image, you can see the sweat chloride test. Okay, so traditional and modern treatments for CF. Traditional CF management focuses on symptom control mainly. So there is airway clearance therapies like chest physiotherapy to help remove mucus. There's antibiotics that manage chronic lung infections, and pancreatic enzyme replacement therapy improves digestion and nutrition absorption. Recent advances include CFTR modulators such as ivacaftor and the triple combination therapy elexacaftor, tezacaftor, ivacaftor, also known as Trikafta. These drugs target the defective protein, restore chloride transport, and significantly improve lung function and quality of life. In the image on the slide, you can see a airway clearance therapy. So, emerging and future therapies for CF. So, looking ahead, researchers are exploring more gene therapy and mRNA-based treatment to correct or bypass CFTR mutations. These approaches aim for a long-term cure rather than lifelong symptom management of CF. So, early-stage clinical trials are ongoing, and the goal is to permanently restore proper chloride channel function, potentially transforming CF into a highly manageable condition with near normal life expectancy. So on the side, you can just see a demonstration of the basis of a gene therapy for CF. So what is the role of allied health professionals for patients struggling with CF? So allied health professionals play a critical role in managing CF. Dietitians help to ensure patients receive high-calorie, nutrient-rich diets to combat malabsorption. Respiratory therapists train patients in airway clearance techniques. Physical therapists assist with chest physiotherapy and exercise routines to maintain lung function. Nurses and social workers coordinate care, manage medications, and provide support to patients and families, improving overall outcomes and quality of life. Okay, so in summary, cystic fibrosis is a multi-system autosomal recessive disease caused by CFTR mutations. At the cellular level, defective chloride transport leads to thick mucus, impaired clearance, and chronic inflammation. Organ systems such as the lungs, pancreas, liver, and reproductive organs are severely impacted. Modern therapies, particularly CFTR modulators, have shifted treatment from symptom management to disease-modifying strategies. Ongoing research in gene therapy and mRNA interventions bring hope for future cures. While CF remains incurable today, advances in biotechnology continue to improve prognosis and quality of life for patients. On the side, you can see a time graph of all of the advancements since the first diagnosis of CF, and we are hoping to reach a cure sometime in the near future. Thank you guys for listening to my presentation on cystic fibrosis. I hope you were able to learn something about the disease. Here is my works cited for the presentation. and one more slide with a few more sources down here. Thank you.